Hi everybody, my name is Angel and I have been suffering from plantar fasciitis for quite some time, right? So I just thought maybe I should just create a video and explain what plantar fasciitis is, right? Alright, so what is plantar fasciitis? Plantar fasciitis or plantar heel pain is a disorder of plantar fascia, which is the connective tissue that supports the arch of the foot, right? So this is the arch of the foot and this is the connective tissue that supports the arch of the foot, right? Not sure if you can see it. If this is the arch of the foot, this is the connective tissue, right? It results in pain in the heel, right? This is the heel, and bottom of the foot that is usually most severe with the first steps of the day or following a period of rest. Pain is also frequently brought on by bending the foot and toes up towards the shin, which is true because every time you tip your toe, it hurts. Every time you put your feet down, it hurts. And it happens mostly during early morning when you wake up from the sleep and your first step is extremely painful. And it has a very throbbing and prickly sensation. And it has caused a lot of pain in my life. Okay, so I just thought maybe I should share it. The pain typically comes on gradually and affects both feet in about 1/3 of cases. At times, it has its own variation. For example, if your right foot is the primary foot, right, it will hurt you more on the right foot, but only because you have a lot of weight on your right heels versus your left. But if you have pain on your right foot, then chances are the weight of your body is going to be directed to the left, and eventually the left will also have issues, which will cause some real big pain on your gait, which means that you will have issues walking steadily. At times, I've also felt personally that I've had vertigo issues. I could not stand appropriately, and because of that, the pain would actually divert back upwards, which means that my whole body would have weakness and all I would do is just sleep on the bed. That's all I could do. Now, what causes plantar fasciitis? In my case, I actually had plantar fasciitis because I wore a really um, bad quality flip flops that I bought from Walmart, right? And I paid a very heavy price for it. It's just that it was summer and I was at the beach and I thought maybe I should wear it. And I kept on wearing it even after, and that caused really bad plantar fasciitis, right? So the cause of it's not clear, but it's usually because of your wrongful choice of wrong shoes, right? So you made a decision to wear something for a longer duration, and it caused you a heel spur growth. Risk factors include overuse, such as from long periods of standing, and increase in exercise and obesity, right? So when you are obese, chances are a lot of your weight is, usually on your heels, and at times it can cause a lot of strain and it can increase the heel spur. You may have like a bony growth under your heel because of it, especially if you're not wearing the right kind of shoes that supports your body, and the shoes has to be equal on both the feet, equally. It should not be like, let's say you're just wearing an orthotic on one foot and not on another. That's not how it works. It is also associated with inward rolling of the foot, a tight Achilles tendon, and a sedentary lifestyle. Right. So let's say if you keep on inward rolling of the foot and you're sedentary, you're not moving, you're not doing anything, you're just sitting up tight, it can cause because of that as well. It is unclear if heel spurs have a role in causing plantar fasciitis, even though they are commonly present in people who have the condition. Now, plantar fasciitis is the, like I said, inflammation of fascia, right? But with that, it also comes in with a heel spur, right? So it's actually not known that, plantar fasciitis are caused due to heel spur. But if you have a bony growth, then chances are your plantar fascia is getting extended and it's getting inflamed in the middle. And that's exactly what plantar fasciitis is, inflammation. So it's not clear, but somewhere it does show that they are related. Right? Plantar fasciitis is a disorder of insertion site of ligament on the bone characterized by micro tears, right? Those tears are micro. You actually don't see just a single slit, you'll see micro tears. Breakdown of collagen and scarring. Yes, the collagen and scarring, like I said, there's a heel spur growing, and chances are it is going to impact the structure of your tissue, right? It's going to affect the structure of fascia. The presentation of symptoms is generally the basis of diagnosis, with ultrasound sometimes being useful if there is uncertainty, right? So you can use ultrasound if you're not sure what's going on inside. Other condition with similar symptoms include osteoarthritis, right? Ankylosing spondylitis, heel pad syndrome, and reactive arthritis. Yes, if you have arthritis, you have ankylosing spondylitis, or you have heel pad syndrome, the the symptoms may mimic each other, but in plantar fasciitis, you can actually see there's a heel spur grown. You'll see some micro tears. If you use ultrasound, you'll know. You'll see some numbness in the area where you have, the pain. It will be usually on the medial side of your either or. It will be on the medial side. When you hurt it, you'll feel tenderness and it hurts real bad. Okay, so you'll know that this is not arthritis, because if it's arthritis, or if it is a reactive arthritis, it won't be at just one particular location. It will be a spread out area. Signs and symptoms of plantar fasciitis. When plantar fasciitis occurs, the pain is typically sharp and usually unilateral. 70% of cases, yes, it is unilateral. 70% of cases. Um, Bearing weight on the heel after long periods of rest worsens heel pain in affected individuals. Trust me, you cannot stand. I promise you. If you have plantar fasciitis, I guarantee you'll have a hard time standing. You'll have to sit down. Walking will be very difficult. You have to tippy toe everywhere, and it is a real life. Oh my God! Don't even get me started. Individuals with plantar fasciitis often report their symptoms are most intense during their first steps after getting out of bed or after prolonged periods of sitting. That's true. Okay. Symptoms typically improve with continued walking, yes, but provided you can walk. Provided you can walk. If it hurts a lot, the chances are walking and jogging is only going to make it difficult, right? So let's say after you have your treatments, your therapies, and they're successful, then you start walking. Chances are the likelihood of you having plantar fasciitis back again can be reduced. However, in some cases it can also occur back. Okay, it depends on, like I said, how you walk, what you wear to walk, etc., etc. Rare but reported symptoms include numbness, tingling, swelling, or radiating pain. Yes, I had a lot of numbness. I had a swelling and I had radiating pain. Like you see, these are the micro tears, right? And this is exactly where it happens. When you try to press this area, you will feel like a really bad pain. So even let's say your pain stopped and your podiatrist is trying to press it and check you, chances are the pain will shoot up again. All right, so and that did happen to me. I had a podiatrist and she pressed it and it shot again and it hurt so bad that I literally, I had like a mini scream come out of me. I usually don't scream, but that day was a different day. Scar tissue formation, and this is where you have the scar tissue formation. All right, so as you can see, if you do an x-ray of this area, you'll see a heel spur bone growing here. All right, if the plantar fascia, typically there are no fevers or night sweats. I never had fevers, night sweat, but I put on weight. I was depressed. I couldn't do regular things. I love to dance. I'm usually walking. I'm singing songs, etc. I have a very happy and jovial life, and plantar fasciitis kind of killed it. Okay, and I felt horrible. If the plantar fascia is overused in setting of plantar fasciitis, the plantar fascia can rupture. Okay, so this area can actually rupture and can tear open. So that can be a damage. All right, so before it gets there, you have to fix it. Typical signs and symptoms of plantar fascia rupture include a clicking or snapping sound, significant local swelling, and acute pain in the bottom of the foot. Yes, so it includes a clicking or snapping sound. All right. So when you walk, you'll feel like, oh my God, it hurts. It hurts. It hurts. And that does happen. Okay. Diagnosis: an incident of finding associated with this condition is a heel spur, a small bony calcification. Okay. So this is heel spur. My heel spur was even larger than this. Okay. When I saw my x-ray and I was like, I got a kick. I'm like, what is this growing on my foot? That was actually a heel spur. This is teeny meeny. Mine was a really large. I have absolutely no clue what increased the heel spur, but that did happen to me. An incidental finding associated with this condition is a heel spur, a small bony calcification on the calcaneus. This is the calcaneus, the heel bone, which can be found up to 50% of those with plantar fasciitis. Yes. In such cases, it is the underlying plantar fasciitis that produces the heel pain and not the spur itself, right? The reason why it's actually creating the pain is because you have an extra bony growth that's taking over a lot of space, and it's causing a lot of pain while you walk, right? Because plantar fascia is not going to stretch itself. If you really want this pain to go away, then you have to add an extra tissue here. Okay, you have to lengthen the tissue. But until unless you do that, the pain's not going to go away. Okay, but there are some surgeries which are called as minimally invasive surgery. We'll talk about it, where the podiatrist or foot and ankle specialist, what they do is they usually just enter from the lateral side, and what they actually do is just poke the heel spur and they break it. All right, and they get it out and might give it to their patient saying, hey, you had this object or this thing growing, and patients get a kick out of it, right? So that's what they do. The condition is responsible for creation of the spur through the clinical significance of heel spur. Plantar fasciitis remains unclear. Okay, if you ask me, then I think it is just the overstraining of a particular area which causes a bone to grow, because the body has a way of protecting itself from wear and tear, right? So for example, if we try to use a lot of our fingers, chances are we'll have a hardness our fingers, right? If we try to use a lot of our elbows, chances are we'll have a hard elbow. Our skin is not going to be that soft. Similarly, if you try to wear the wrong kind of shoe, you're wearing flip-flops all day, your body will find a way to protect itself from the extra wear and tear, the burden, the gravity that's impacting, the weight that is put on. It will try to harden it. Then how does it do it? It tries to increase or grow a certain part that protects it. And in this case, it's actually the heel spur that's protecting. It's just that it's not growing in the right direction. It's growing outward, right? Because anything that grows under your feet, it will grow outward, but at the same time, it will cause a lot of pain to the person. Okay, so if you ask me, then I think it's just the extra strain that's causing heel spur to grow. Plantar fasciitis is usually diagnosed by a healthcare provider, usually a foot and ankle surgeon or podiatrist, after consideration of persons presenting history, risk factors, and clinical examination. Right? I remember, going to a podiatrist, and she came in, she took my blood pressure, she took my history, she asked me all the questions, and then she started looking at the place where I had a swollen, it was hurting. She just touched and said, is it hurting here? Is it hurting there? She also took my x-rays and she said, okay, well, you have a heel spur going. This is like a case of chronic plantar fasciitis. So that's pretty much she did. It didn't take a lot. It's just that the plantar fascia pain that I had was more on right side than left side, because my right foot is a primary foot. So that's the presentation. The presentation itself is the numbness. The presentation is the swelling, and also the tenderness of the area where I have the inflammation. Another is the x-ray. That itself speaks volumes. And also the symptoms that I cannot, early morning when I wake up, it hurts me, I can't walk, etc., etc., etc. All right, so those are symptoms of plantar fasciitis. Palpation along the inner aspect of the heel bone on the sole may elicit tenderness, right? It's the inner sole. The foot may have limited dorsiflexion. Dorsiflexion is upward, and plantarflexion is downward. This is dorsiflexion, this is plantarflexion. Excessive tightness of calf muscles. You'll see some tightness in calf muscles or Achilles tendons right here, this area. You'll see a tightness. Dorsiflexion of the foot may elicit the pain due to stretching of plantar fascia with the motion, right? So if you cannot do it in motion, why? Because it's hurting so much, you can't do it. Diagnostic imaging studies are not usually needed to diagnose plantar fasciitis. However, most of the podiatrists would have an X-ray machine. They will ask you a few questions: Are you pregnant? Are you not pregnant? Are you allergic? When was the last time you had an X-ray? And then they'll ask you to get an X-ray, because that is the best way of knowing. Otherwise, a podiatrist can never really tell you what's inside your feet. You need an X-ray. All right. The biggest friend of a podiatrist is an X-ray machine. Be friends with your machines. Trust me, they will love you back, because you may not believe what someone's saying, but you will believe what machine's showing, right? So be friends with your machine if you are a podiatry student or a podiatrist. Occasionally, a physician may decide imaging studies And they are warranted to rule out serious causes of foot pain. They will actually help you decide, is it chronic, it's not chronic, do they need surgery, non-surgery. So diagnosing becomes very easy. Achilles tendon tightness is a risk factor for plantar fasciitis. It can lead to decreased dorsiflexion of the foot. So if you have a tightness here, chances are your dorsiflexion is going to be very difficult. Okay, so at times, plantar fasciitis may also mimic Achilles tendonitis, so you have to be very careful on what is hurting. And like I said, if there is any condition that's impacting, dorsiflexion or plantar fascia, the X-rays will be able to tell you what it is. Is it plantar fasciitis? Is it tendonitis? Is it, like we just said, heel pad syndrome? The symptoms may mimic each other, but X-rays will tell you, everything that you need to know. In theory, plantar fasciitis becomes more likely as the plantar fascia's thickness at the calcaneal insertion increases. So this thickness increases. This is the this is the calcaneal insertion. As you can see, there is a bone growth here. Can you see this? You see this? There's a little bit of bone growth. These are just air pockets. That's what I think. Okay. A thickness of more than 4.5 mm ultrasound or 4 mm on MRI are useful for diagnosis. In theory, plantar fasciitis becomes more likely as the plantar fascia's thickness and the calcaneal insertion increase. I guess that's a repetition. That's a typo. That's tibia, that's a talus, that's a cuboid, and that's a calcaneus, the heel bone. That's plantar fascia thickened and inflamed. You see this? You can actually see, and this is where it actually the presentation shows when you try to hold it down, the patient's going to say, oh my god, it hurts, and that's how you know that it's not Achilles tendonitis because it's right here. It's plantar fasciitis because it has an inflammation of plantar fascia. Non-surgical treatment, physical therapy. A physical therapist can show you exercises to stretch the plantar fascia and Achilles tendon and to strengthen their lower leg muscles. So if you go for a conservative route, say, I don't want a surgery, if your podiatrist is saying, okay, let's try, non-surgical treatments for now, and maybe if it worsens, we'll come back for the surgical treatment. A therapist, you have to take the appointment of physiotherapist, but a physiotherapist also might teach you to apply athletic taping to support the bottom of your foot. What are night splints? Your care team might recommend that you wear a splint that holds the plantar fascia, this one, an Achilles tendon in a lengthened position overnight to promote stretching while you sleep. Orthotic, your healthcare professional might prescribe off-the-shelf or custom foot arch supports called orthotic to distribute the pressure on your feet more evenly. Dr. Scholl's, okay, I was advised to wear good quality shoes for plantar fasciitis and Dr. Scholl's. So I just bought myself a really awesome shoe and inserted Dr. Scholl's, and that helped me a lot, right? Walking boots, canes, or crutches. Your healthcare professional might suggest one of these for a brief period, either to keep you from moving your foot or to keep you from placing your full weight on your foot, right? So walking boots may be advised, yes. Um, Something also helped me greatly is a ball like this that kind of helped me stretch my foot, my plantar fascia, in a way that helped me with pain relief. The worst part of plantar fasciitis is the pain. It's actually not the tenderness, it's actually the pain that kills you because you cannot walk, you cannot move. Even if you wear shoes, it is very, in the start, it hurts. Eventually, it fades itself down, but it hurts a lot, okay? I'm just telling you. About 90% of plantar fasciitis cases improve within 6 months with conservative treatment and within a year, regardless of the treatment. Okay, so it usually gets treated on its own, and it gets treated with conservative treatments in 6 months itself, right? The recommended first treatment is a 4 to 6 week course, which combines three elements: daily stretching, daily foot taping, special tape around the foot for supporting each arch, individually tailored education on choosing footwear, and other ways of managing the condition. Taping can reduce the amount of stretching and moving the ligament does when you're on your foot on your feet. Sorry. This not only gives your plantar fascia a chance to heal, but also helps prevent further damage. Okay. In taping and in shoes, you have to be very careful that you have to keep everything very sanitized and hygienic, because if you're not careful, then after plantar fasciitis, you'll end up with athlete's foot. And it is the worst thing that can happen to you, because it not only stings, but at the same time, it's very itchy. And you have to keep your feet maintained all the time. And it hurts because you cannot keep your feet, in open. You have to wear your shoes, and it has to be very much covered. At times when you wear your socks, you apply moisture, and a cream that donates moisture to the feet, but at the same time, when you wear your socks, the socks may absorb the moisture too, and that itself causes, a lack of moisture, and you'll be back where you started. You'll have athlete's foot again, all right? And it stings. At times, it's also tender. It looks very bad. From dry skin, it slowly and slowly becomes reddish, swollen. Um, it will start getting, sometimes it bleeds as well. Sometimes it also causes hard areas on your feet, and that itself is also very painful. All right. So, with taping, with shoes, you have to be careful that yes, I have plantar fasciitis, but I cannot ignore the daily hygiene. Okay. So that's it. So taping not only gives your plantar fascia a chance to heal, but also helps prevent further damage, which is true. However, stretching exercises works the best. Okay, so you have the daily stretching, which will help you the most. Other conservative approach includes rest, massage, heat, ice, and calf strengthening exercises, weight reduction in the overweight or obese, and non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen. Yes, but most of the cases, the pain is so bad. Controlling the pain with medication does not really help. What actually helps is massage, but you should know how to do massage. If not, you'll end up hurting yourself. Heat does help. Ice helps a lot. I tried a lot of ice, and it felt like it was reducing my inflammation, which means it was reducing my pain, and I really liked it. What actually helps, like I said, the ball thing that I just showed, right? That ball would actually help my arch and would reduce the pain, but the pain would come back as well. All right. So if you think that if I do something so easy, it will go away, it won't go away. It will keep coming back. You have to manage it. All right. So yes, it may treat plantar fasciitis, but to be honest with you, eventually it will fail because the pain will come back and your plantar fasciitis will come back. Okay, because that is not actually treating the cause; it is only treating the symptom, which is the pain. All right, not the real reason why you have it in the first place. Other conservative approaches include rest, massage, heat, ice, weight reduction, like we just said. Um, Common, but their use fails to resolve the pain in 20% of the fail. I wonder what's going on with my PowerPoint. uh, Yoga and stretching exercises. Yoga and stretching exercises helps a lot. However, what the really sad part of yoga and stretching exercises, the minute you stop doing it, it will come back. Okay, so the minute you stop doing it, it will come back. So you have to do it every day. You have to daily. A lot many people say to you that, oh, I had a heel spur, it got dissolved, and it went away. Trust me, it is not as easy as that. Okay, trust me when I say that it's not as easy as that. You have to keep doing it every day to help yourself. You do it at least 10 times, I think you'll be fine for 2 3 days, but then you have to do it again. For example, I did the same yoga and stretching exercises, the exact pose, right? Stretched my feet up, with my hands, and it helped me a lot, but then again it came back as well, all right? So you have to keep doing it. Best plantar fasciitis exercises. This is Achilles gastrocnemius stretch, all right? So this is Achilles. So you have to put like if you have a table like that, a small one, you have to put your feet, and you have to make sure your feet are actually stretched and they are a little upwards. You can also do plantar fascia massage, all right, with your own feet. You can massage your plantar fascia. Soleus muscle stretch. You can actually put your hands on the wall, Bend a little and stretch it. This is a plantar fascia stretch. This is wonderful. This is the best exercise you can do. You know, you can actually ask your therapist to give you something like this. If not, you know, you can use anything, a rubber band to pull your feet towards yourself, okay, to your body, and see how it feels, because trust me, it will feel great because it will help you. Towel toe curl, which is actually also very good. So you have to put your feet on your towel and curl it towards yourself, because when you do, I think it will curl it towards you. Toe extension, this is the toe extension, which means that you're actually pushing on a wall. This is a wall, you're pushing on it, and you're trying to extend your toe towards the wall, right? So you're literally pushing it in. And trust me, this will work. But the best exercises would be these two: plantar fascia stretch and towel toe curls. They will do wonders for you. I promise you that, okay? Now, what are the surgical treatments? Plantar fasciotomy is a surgical treatment and the last resort for refractory plantar fasciitis pain. If plantar fasciitis does not resolve after 6 months of conservative treatment, then the procedure is considered as last resort. Plantar fasciotomy, right? That is going to be your last resort. And I do remember one of my podiatrists actually asked me to get a surgery. I refused. I don't want surgery, but I have a very strong feeling that was going to be my last resort. I may have to travel back to New York, but you know, that is going to be something that I will be getting sometimes in the future. Minimally invasive and endoscopic approaches to plantar fasciotomy exist but require specialists who are familiar with specific equipment. The availability of these techniques is limited as of 2012, which is true. Minimally invasive surgeries are available, but not all the clinics may have them, right? Especially the ones that require endoscopy. Not all clinics may have them. I have seen some videos on YouTube where I saw a few of the doctors that were in London that were using endoscopic plantar fasciotomy, which is very common in those countries where minimal invasive surgeries are, you know, very prevalent. So they're available, but very less. A study found 76% of people who underwent endoscopic plantar fasciotomy had complete relief of their symptoms and had few complications. Yes, so it is very effective, but provided you have a clinic that offers that service. In select cases, surgeons may perform release of lateral plantar nerve alongside the plantar fasciotomy. Yes, so they may release because that if that's causing you a lot of problem. Possible complication of plantar fasciotomy include nerve injury, instability of medial longitudinal arch of the foot, fracture of the calcaneus, yes, prolonged recovery time, infection, rupture of the plantar fascia, and failure to improve the pain. You know, that's the biggest cause. My only fear with plantar fasciotomy would be nerve injury and a damage, rupture of plantar fascia, you know. So that's why whenever you talk to your surgeon, you talk to your foot and ankle surgeon, you have to ask them what is the contingency of tissue damage and what happens during an emergency situation, you know. I don't see plantar fasciotomy causing death or anything like that, but I do see if it causes a nerve injury, it will cause some serious instability, you know, with regards to either issues with, how do you call this, the numbness, or you may have a tingly sensation, or you may not be able to operate you know, a few parts of your feet. For example, you may not be able to operate your toes, you know, so you have to be careful about it. The coblation surgery has been proposed as an alternative surgical approach for the treatment of recalcitrant plantar fasciitis. Yes, I'm aware of it. There's something called as topaz treatment, okay? And they have been very common in India. You know, it just requires one incision with a topaz needle, and it kind of works on a radio frequency. It works on a frequency technology, which is really interesting. I'm not sure if it's available in the United States, but I have seen some surgeons operate plantar fasciitis with a frequency. The cortisone shot is generally applied to the most painful area of your plantar fascia where the steroid gets to work, right? So the cortisone shot is applied. I personally got a cortisone shot with a really big needle, and trust me, it was hurting. It was painful. I had it 2 to 3 times. In most cases, it takes 2 to 3 days before the relief is noticeable, but can work sooner depending on the severity of your plantar fasciitis. In my case, it started working right away, let's say maybe 6, 7 hours, but it did not last for very long. Okay, it lasted for maybe 2 weeks and it faded away. So cortisone may be okay for a few days, but it's not a forever treatment. So shots only help you for some time, just like it would help any part of your body. Okay. Gastrocnemius recession is a surgical procedure that involves lengthening of the gastrocnemius muscle to reduce the tension in the Achilles tendon and plantar fasciitis. Yes. This technique improves the ankle's range of motion, reduces pain, can help patients return to work, sports, and weight-bearing activities more comfortably. The procedure is particularly beneficial for individuals with limited ankle dorsiflexion upward bending due to tight calf muscle, which can aggravate plantar fasciitis symptoms. Right, so gastrocnemius recession is also something that can be done to help with plantar fasciitis. Your surgeon may perform the surgery through several different incisions, most commonly a small incision made on the inner side of the lower leg. Sometimes an incision directly in the back of the calf is used, or even endoscopic incision, which is about half an inch. Once the gastroc tendon is identified, is separated from the underlying muscle belly of the soleus, then cut straight across. Once the tendon is released, the ankle is flexed up, and increased range of motion is noted intraoperatively. Right. So, the reason why it's actually performed is because you want to make sure there is an increased range of motion. But gastrocnemius recession is only done for those that may have chronic plantar fasciitis. Okay, if you have plantar fasciitis, that can be treated with plantar fasciotomy, that can be treated with conservative methods. Gastrocnemius would be a far off treatment. They don't really just prescribe it just like that. There's no suggestion of it right away. It usually takes a year before a surgeon even, says, hey, would you like to do this, etc. Okay, so epidemiology. Plantar fasciitis is the most common type of plantar fascia injury, and its most common reason for heel pain response for 80% of the cases. Trust me, it's very common. I remember working for a foot and ankle surgeon, and we would have at least 2 to 3 cases of plantar fasciitis on a daily basis. And trust me, eventually I got so used to it that I could actually talk to the patients myself. Okay. The condition tends to occur more often in women, military recruits, older athletes, dancers, people with obesity, and young male athletes. Plantar fasciitis is estimated to affect 1 in 10 people at some point during their lifetime, and most commonly affects people between 40 and 60 years of age. In the United States alone, more than 2 million people receive treatment for plantar fasciitis. The cost of treating plantar fasciitis in the United States is estimated to be 284 million each year. Okay. So if you're a podiatrist, that is the economy of podiatry right there. So if you're, think twice if you want to change your field, because this is where the dollar bills are. So you know what you're getting involved with. Prognosis. According to a study following patients with plantar fasciitis over several years, 20 to 75% of individuals no longer have any symptoms within a max of 1 year after the onset of symptoms. Having a heel spur, bony protrusion at the heel, in addition to heel pain, does not worsen the prognosis of recovery. Okay, individuals with or without a heel spur recover at the same rate. Trust me, most of the times when you have plantar fasciitis, you will have a heel spur. Your plantar fasciitis will not be healed until and unless your heel spur, is taken off. So you will have to remove it. You will have to remove it. All right. So if you have plantar fasciitis, I would like you to keep calm and see your podiatrist. Don't just stay home. A lot many people have a tendency to ignore their pain. They might just take an aspirin. They would prefer watching a movie or going to work. They don't even care about it. Don't do it, right? If you have it, go to podiatrist. If you don't have an insurance, don't want to spend money, at least get Dr. Scholl's from Walmart. They're just like $10, and as per the size of your shoe, go ahead and insert it and wear it every day. Um, if you can do all the stretching exercises that I just showed in the PowerPoint, I think it will help you a lot. You can also do the ice bath thing that I just showed you. You can also do the ball thing. Wherever you find Dr. Scholl's or Walmart, you also see some balls hanging. Just get it and try to massage your feet with it. That will actually release your pain. Taking painkillers can be very heavy on your liver, right? So you may think, oh, it will help pain go away, but trust me, it is going to be very difficult for you in the future, because that only means that it is very heavy on your liver, and some point it is going to show on your health. Okay, so I would suggest you, be very careful how you walk, and be careful type of shoes you wear. Be very careful if you are wearing shoes, you're using the tapes. Make sure you're also very careful with your feet hygiene, which means keeping them well moisturized. Also trying to scrape the dryness off your skin. That would help you a lot. Okay. All right, so this was me talking about plantar fasciitis. I will make another video to talk about, what happened with my plantar fasciitis, because I have a really good podiatrist and she's helping me. Looks like I'll eventually have to get a surgery. So I will make another video on plantar fasciitis post surgery. Okay, bye.